Hi, everybody. My name is Deborah Axelrod, and we love doing these programs for you. I think they're highly informative. If there's something that you think can be improved upon, let us know. Our topic tonight is credible cancer information and how do you obtain it? Well, you can get credible cancer information, but if you can't understand it, then it's really for naught. And so I'd like to talk just a couple of minutes about health literacy. And you would be surprised about how many people in the United States are not health literate. 12% of people in the United States are health literate, which means the rest of them aren't. So I'm going to talk a little bit about that and why it's so important. But I want to give you an example of where where you would see that in practice. And I'm sure that you have friends and family who've gone through illnesses, and it's really hard sometimes to understand what you're presented with. So Sherry's a 53-year-old woman who's referred to a clinic for care following a 4-week hospitalization. And upon discharge, she's provided with a handwritten list of medications. And when she's asked by the clinic staff why she was admitted, Sherry says, "I had a bad cold." But her hospital records show an admission for pneumonia, complicated by congestive heart failure and diabetes. And although Sherry's hospital physician said that they communicated these diagnoses, she left the hospital without a full understanding of her condition. So why is that important? Well, that's important because when you have a low health literacy, you have complications, especially if you have a chronic disease. You require more days in a hospital. You require more hospital care. And you have less trust in doctors and the people around you who are giving you the information. It's interesting because people who have low health literacy, when you ask them where they get their information, they get their health information from celebrity websites, from blogs, from pharma sites. Whereas if you ask someone who have proficient health literacy, they get their information from specialists, from physicians, physician extenders, and also from medical websites. So I know that each of our speakers are going to be speaking about something, one facet in particular about that. But I'm just going to share my screen. I have only like a couple of slides, so I'm not going to torture everyone. Okay, these are our speakers, and I will introduce each one of them before they come to the podium, kind of like the virtual podium. So the Institute of Medicine in 2004 said that health literacy is the ability to obtain, process, and understand basic health information and services needed to make appropriate health decisions. And health information should follow the 3 A's: accurate, accessible, and actionable. And again, if you don't have a proficient health literacy, you're not going to be able to make sound decisions. So that's important because that will negatively impact your health care. And as I said before, only 12% of the population in the United States is health proficient. So that's a real deficit here. Now, if you're wondering like what kind of health literacy you have, there's a very, very good test called the newest vital sign from Pfizer. You can go online, but I gave this test to my girlfriend who runs a jewelry company, and she is a diabetic. This is called the ice cream labeling test, and it assesses your ability to read and understand numbers. And that's a big thing when it comes to your healthcare, especially in cancer when you're making these decisions. So everybody knows about this. It's like a Haagen-Dazs ice cream container. It tells you the servings, the fat, cholesterol, all this, the carbs, how many sugars, protein, how many servings. So the kind of questions, I've memorized this totally because it depends on how much you like ice cream. But there's actually 6 questions. And if you get 4 or more, you have good health literacy. So if you eat the entire container, the amount of calories that you're going to eat is 1,000. That's the only answer. And if you're allowed to eat 60 grams of carbs as a snack, how much ice cream could you have? And it would be 1 cup or half the container. Like, why would I say that? Okay. So it would be 1 cup. If you're allowed 500 calories, each serving is 250. Okay. And let's see, if you're allowed the 60 grams of carbs, right? So 30 grams are in one serving. And so if you're allowed 60 grams, then you're allowed 2 servings, and 2 servings are half the container. Okay. If your doctor advises you to reduce the amount of saturated fat in your diet, usually have 42 grams of saturated fat a day, which includes 1 serving of ice cream. And if you stop eating it, then how many grams of saturated fat do you have left? So the only answer is 33. You can go online. It's really, I really think it's very engaging. But my girlfriend, who is a highly functioning person with a chronic illness, is really health illiterate, and so I think that probably impacts hemoglobin A1C. If you eat 2,500 calories in a day, what percentage of your daily value of calories will you be eating? Well, we know that 1 serving is 250 calories, so that's 10%. And finally, if you're allergic to the following substances: penicillin, peanuts, latex gloves, bee stings, is it safe for you to eat ice cream? And the only answer is really no, because it has peanut oil. So this is how important it is. Health literacy affects really everything in your life. So I want to thank you for everyone coming, and I'm going to introduce Nancy Stewart, who I've worked with for the last 7 years. It's really a privilege to work with her. Nancy is a health educator. She really spends a lot of time with people and does the follow-up care, and that's also important. She has a great listening ear. Nancy is a certified breast care nurse at NYU Langone Health, and she earned a master's of nursing with a concentration in leadership and education from the University of Washington. And she is the co-chair of Perlmutter Cancer Center's Patient Education Committee. So I would like to introduce Nancy Stewart.
My portion of the talk is just about the importance of cancer education for prevention, ongoing care, and survivorship. And I can't fast forward my slides. There we go. As Dr. Axelrod just said, the importance of health literacy, and she mentioned some of these things that can impact health literacy. But there are a couple others that I just want to point out. One is preferred language. So sometimes people are, they can speak English, they can get by, but if you want to give them written language or written information, it's really important that they get that in the language of their choice, the preferred language that they read and feel comfortable in. The other thing that I wanted to point out is the impact of stress on health literacy. So like Dr. Axelrod was saying, she has a girlfriend who's very literate, very smart, very with it woman whose health literacy is not the best. You can imagine if you get a diagnosis like a cancer diagnosis, and the impact that has on your ability to take in this very complex information that you're being given. So just another factor that I wanted to talk about with regard to health literacy. Sorry, I'm having a delay in forwarding my slide or advancing my slide. There we go. So patient education is a way to improve health literacy, obviously. It's been shown to be essential to improving healthcare outcomes. It affects positive change in knowledge and skills necessary to manage illness, which we already talked about. It's vital to helping oncology patients navigate their diagnosis and cope with treatment. And studies have shown that it results in demonstrated improvements in cancer-related pain and fatigue. Also, that it lessens emotional distress, improves quality of life, and enhances resilience. So prevention is really how to stop cancer before it starts. And patient education is a huge, uh, important way uh, to help achieve this. So barriers to prevention are really similar to uh, some of the barriers that we have for health literacy. So lack of access to care, language barriers, cultural beliefs. Um, there's also studies have shown differences in health-seeking behaviors between men and women. That women have a much more active role in health-seeking behaviors and cancer prevention behaviors than men in general. Also, misinformation is a big barrier to prevention, and we'll talk a little bit more about that. The other thing that I wanted to mention about prevention is that we really need to start this early. So education about cancer prevention should begin in adolescence. There is a long induction time for some cancers, and there's also a rising incidence of early onset cancers. So cancers such as colon, breast, lymphoma, they have all been shown to just develop earlier and earlier in patients. And, doctors have recognized that this is happening, but they haven't been able to figure out why it's happening. They're moving up the date to begin some screenings, but all the more reason that we should be talking about people at a younger age about cancer prevention. Um, Also wanted to mention the HPV vaccine, which is very effective at cervical cancer prevention, and that's something that we should be giving women during adolescence. So some of these modifiable behaviors are things that start often, risky behavior often does start in adolescence. So, teenagers start messing around with smoking, alcohol. They can go out and, spend too much time in the sun. They want to get tan, a poor diet, not enough physical activity. And all of these are things that can impact cancer risk. So again, these are things that we should be thinking about with regard to educating people and start early. So as I mentioned, cancer rates in younger people are going up and cancer rates in general are increasing. So about 1 in 5 people will develop cancer in their lifetime. And the International Agency for Research on Cancer, which is a body of the World Health Organization, in 2022, they estimated about 20 million new cancer cases worldwide. And they projected new cases to rise to 35 million by the year 2050. Some of the contributing factors that they mentioned were an aging population, population growth in general, things that we know cause cancer, so tobacco, alcohol, obesity, and also exposure to environmental pollutants. So ongoing care obviously is during active cancer treatment. And I just wanted to talk a little bit about the importance of education, patient education during that time. So when you're diagnosed with cancer, the normal response is to kind of freak out, right? And say, well, what does this mean? Am I going to be okay? How is this going to impact my health, my relationships, my job, my finances? And with cancer diagnosis, there's typically a big knowledge gap. So unless you happen to be an oncologist with a specialty in the type of cancer that you happen to develop, most people, when they're diagnosed with cancer, know nothing about this diagnosis and what it means. So often there's a lag time between when they get the diagnosis and when they see the specialist. So obviously there's this desire to get information. You need to know that you're going to be okay. You need to know what's going on. So you look for information anywhere you can. So the obvious place is your existing medical team. So whoever gave you the diagnosis, often, people ask for more information, and sometimes your internist or gynecologist or whatever doctor gives you this diagnosis. Sometimes they don't have that much knowledge about the type of cancer that you've been diagnosed with, and they don't want to give you any misinformation. So sometimes they say, this is what you have, but you really need to go speak to the specialist. So sometimes they're not really able to give you the depth of information that you need. So often people turn to friends and family. So in particular, I work with breast cancer, as Dr. Axelrod said. A lot of times people say, oh, well, my mother had breast cancer, or my sister's best friend's daughter just had breast cancer. And they look to those experiences and those family members and friends and try to glean what information they can from someone else's cancer, which may not be the same as the type of cancer that they've been diagnosed with. Um, Obviously, everybody turns to the internet. So Dr. Weiss will be speaking after me, and she'll go into this in a lot more detail. But the internet, we all know Dr. Google. So there's a lot of information on the internet, and it's really hard if you're a layperson to know how to understand whether or not the information that you're getting is credible. So she'll talk about that. We're in this big new beautiful world with AI and chatbots. And so a lot of times when you type something into a Google search, you're actually interacting with AI, and you know it's who can really say at this point. I know they're doing studies about the efficacy of health information from AI, but we're not really there. Um, People turn to social media. That's another big place. There are healthcare apps. As Dr. Axelrod mentioned, celebrities. So, somebody famous, they had this cancer. Let me see what they had done, what their outcome was. Um, and then also, as Caitlin is going to speak about, library and print sources as well. So I want to talk a little bit about the information you get from the doctor's office. So your oncology care team is made up of a lot of different people. And when you're first diagnosed, obviously, all the information that you're getting, it can be pretty overwhelming. So the doctors that can be part of your care team are medical oncologists, surgical oncologists, radiation oncologists, also possibly reconstructive surgeons, depending on, if you're having surgery and what type of surgery you may be having. There are nurses, so nurse practitioners. Some facilities have nurse navigators, oncology nurses. You could have infusion nurses. You could be sent for genetic testing. So then genetic counselors would be involved, social workers, potentially case managers. Also, after you've had treatment, you may need a rehabilitation therapist. So that could be physical therapist or occupational therapy, and also registered dietitians. What I left out of this slide actually is you may also be meeting with mental health therapists or psychiatrists, psychologists, to help you deal with some of the emotional anxiety, depression, things that you may experience with diagnosis. So obtaining information from your care team, it's really important to know how to advocate for yourself, to get the information that you need. So I recommend that you bring a friend or a family member to any important appointments, particularly with a new diagnosis, for them to be a note taker, an extra set of ears for you. You can also request to FaceTime a loved one or a friend, or call them so that they can join into the conversation if they're not able to accompany you in person. You can ask to record consultations, but please do ask to do that. Also, please ask for clarification. So if you are in a doctor's appointment and you're not understanding anything that's being said, please ask them to explain it differently. Ask them to explain it again, so that you can understand what's going on. Also, ask who to contact if you have additional questions after the fact, and what the best contact method is. Some doctors, like Dr. Axelrod for one, really likes to communicate over my chart. And sometimes they should be calling the nurse navigator at the office. Just an idea of how to get in touch with your team. It's really important. And also ask for resources, so reputable sources of online information, support groups, any help groups, just to kind of get your bearings. I just wanted to say that, obviously there's life after cancer diagnosis. Improvements in cancer care have increased survival for most cancers, and that results in the need for management of long-term health effects of cancer treatment. So I'm going to pivot here to survivorship. Survivorship is the transition from active treatment to post-treatment care. And we talked about the fact that cancer rates are going up, but survivor rates are also increasing, which is the good news. So in 2022, the IARC estimated that about 53.5 million people were alive within 5 years of their cancer diagnosis. And breast cancer in particular, the 5-year survival rate for breast cancer went from 72% to over 90% in the past 30 years. These improvements mean that cancer can often be a chronic disease, be managed as a chronic disease now. And as such, that requires an active role for patients and their families. And that requires patient engagement. And for patient engagement, that requires patient education. So we're all a team together in managing the side effects and everything that comes after the cancer diagnosis. So when we have engaged patients, that improves treatment adherence, satisfaction with care, and health outcomes. So with cancer treatment, obviously surgery, radiation, and medication, those all can lead to physical symptoms, fatigue, pain, functional changes, and they can also lead to emotional symptoms as well, such as depression, anxiety, cognitive changes, fear of recurrence. And patient education is very important for the management of these symptoms and for improving patient outcomes. So the survivorship care plan is one way that that healthcare providers try to help make a plan with patients, and also it's a resource for the other healthcare providers as well, so that everybody knows what the patient has gone through, so that it provides a treatment summary and then also a plan for long-term care moving forward. So that includes information about cancer diagnosis and treatments, any psychosocial services that the patient has undergone, and then a screening schedule moving forward. So it's really important to know, when am I due for my next mammogram? When am I due for my next colonoscopy? All of those things would be on the survivorship care plan, so that we can make sure that not only does life not stop at a cancer diagnosis, but that the patient takes a deep breath and remembers, I need to take care of other parts of my body as well. So prevention of other illnesses. So the other thing that I just touched on briefly is it's a resource for other healthcare providers. So when you go back to your gynecologist or your primary care physician, you can share that information with them, and they'll know exactly where you're at. So that's it for me. Thank you so much. I really appreciate it.
Let's go on to our second speaker. This is Marisa Weiss. Dr. Weiss is well, she's a radiation oncologist and a nationally recognized breast oncologist, author, patient advocate with over 35 years of clinical leadership in the Philadelphia region. She's a breast cancer survivor and a trailblazer in the field and is known for her bold, innovative work in patient education, empowerment, and survivorship. She is the founder of breastcancer.org. And when we look to give information out, we go to breastcancer.org. That is that is truly our Bible. And except for what, of course, Nancy gives the patient. But it's a terrific website, and a little bit of skepticism for other sites is in order, but not for breastcancer.org. She serves as the director of breast radiation oncology and breast health outreach at Mainline Health, where she combines clinical excellence with community engagement. She's a published researcher, trusted media voice, author of 4 acclaimed books that have shaped the national conversation on breast health. You better believe it. So, Dr. Weiss.
Thank you so much, Dr. Axelrod, and great to follow Nancy. You guys take such great care of your patients and they love you for it. And it's because you are so committed to health literacy and giving people access to the best medical information so that they can go into their doctor's office and share the decision making, these big decisions they have to make for their life. So I'm very grateful to be part of this opportunity, this conversation you're having. And as someone who has walked this path both as a doctor and as a breast cancer patient, I know firsthand how confusing and overwhelming the medical information is. I mean, the language is like, HER2 oncogene and aromatase inhibitor, trastuzumab, all these fancy words. And like, as Nancy was saying, and as Dr. Axelrod was saying, that most people don't understand those words; they're not common English. As a patient, you're expected to make these big, complex decisions very quickly, often without enough information, clarity, or emotional support. The stakes couldn't be higher. It's your life that's at stake, and the information is overwhelming, and the system doesn't always slow down to meet people where they are, to know all those different things that Nancy mentioned, those barriers to the care that you need, all those access issues, the language, as Dr. Axelrod was talking about. I mean, like a lot of systems can't slow down enough to meet people where they are. Uh, and there is a law that was passed called the 21st Century Cures Act that gives you that built on HIPAA laws, but basically gives each individual the legal right to not just get access to your medical information, but in a portable form so that you can access it and take it with you and be in charge, have your autonomy, go where you want to go and not ask permission to get what you need, in order to facilitate the information you need to facilitate these other opinions, let's say. Uh, and with the 21st Century Act, you have access to all of your records immediately. So, for example, you may have seen your pathology report drop as soon as it came out, but your surgeon might be in the operating room and hasn't had a chance to connect with you. That your surgeon, she hasn't seen it either. You saw it first because you got a notification, and it's a scary report to read. It's hard to understand what it means for you. And that's when people come to breastcancer.org, when they're, scrambling, frantic, in a panic, worry. Life was relatively normal, and then they get this call, or they feel something and they know, like, oh no, there's something, I feel something that's not like the rest of the breast tissue. It's not on the other side, and your mind goes to the worst place right away, and you feel fear for your life. Just this past week, one of our colleagues at NYU Brooklyn saw patients who thought they were on the right path because they had gone to Dr. Google and Dr. ChatGPT, and they got their medical information from them. They thought they were on the right path, but they weren't. Dr. Google, Dr. Google, and ChatGPT, they don't have a medical license and they don't know what your unique situation is. So I started breastcancer.org 25 years ago because I wanted to create a safe place where people could get trusted medical expert information anytime, anywhere. Uh, Back then it was considered radical. People told me, "You are crazy. That's so hard to do. Let someone else do it." But I knew it was something that had to happen because the average time with a doctor, this is not Dr. Axelrod or the other physicians at NYU, but is 7 minutes. The average time is 7 minutes. It's not enough time to really understand, what did the doctor just say? What does it mean? What does it mean for me? What do I do about it? How do I get out of this, difficult situation that I'm in? And while it was radical, the idea was radical back then. Well, today, a safe place to go for medical expertise and support is essential. Uh, at breastcancer.org, we make sure that all the information is reliable. It's from medical experts. It's evidence-based and has language that's understandable. Again, we need to use the words that are used that you hear in the hospital, but we also make sure to explain what they mean. Um, when I first started breastcancer.org 25 years ago, there were very few choices. There was one size fits most way back when, but now each person's situation is so unique. It's not just the uniqueness of your diagnosis, it's all your other medical concerns and considerations. Like what Nancy Stewart was alluding to, you've got other stuff going on in your life besides breast cancer, and everyone's situation is unique. The genetics you were born with, the genes that may have changed inside your body that are in the cancer, there for so many reasons. How you make decisions, your cultural context in which you experience illness, and if maybe someone else in the family has had breast cancer and something, they had a bad outcome, and that just you live with that. But for all those reasons, your situation is unique. Okay. And effectively, you have a rare disease. It's as unique to you. It's only you who has what you have. Yeah, you can learn from others, but basically, because breast cancer is the most common cancer to affect women these days, and because each person's situation is so unique, I think about breast cancer as like the biggest collection of rare diseases as a result. And while there was no, in the past, maybe one size fits most, now there is no generic approach. There's no one size fits most or one size fits all. It's not what worked for somebody else, your neighbor, your friend, your teacher, your the coworker, the celebrity, as you heard. It's what matters. It's what applies to you personally today. Um, One question that came up was, can you trust what you read online? Can you trust an advocacy group? And as Dr. Axelrod mentioned, there are various sources on the web, and you may have put something up there a long time ago, but if it's not continuously updated, it's outdated and it's no longer useful. And in fact, it could be misleading, lead you down the wrong path. I remember when IBM Watson was doing a focus group of oncology people about 10 years ago, and they showed a case of a young woman being diagnosed with an aggressive cancer who clearly needed chemotherapy. And IBM Watson was supposed to be able to go into the literature and pull out what the answer to what this woman needed, and it came out with an answer that was true 20 years before that. And today we have much better treatments that are not just more effective but safer, because the old-fashioned treatment was less effective and had a higher risk of a serious side effect like leukemia. So it was truly the wrong answer. And they went back and kept working on it to make sure that whatever whatever IBM Watson or any other form of artificial intelligence, AI, it pulls from information that it's given, called the corpus. This body of knowledge is called the corpus. and it's like going to a restaurant, they've got the menu, and you ask for a hot dog with sauerkraut with mustard on top, fine. But if you ask an AI robot for information, the quality of what it spits out and gives you on your food tray, it depends on what information is in the bank, as it were, in the corpus. So that's why medical expert information, it can only be valuable if it's interpreted by experts in the field, if it's understandable, as Dr. Axelrod and Nancy Stewart just said, the information has to be accessible to you in a language you understand, a language you can think about, in a language that you can then pronounce properly to ask a question of your doctor, and in a way that you can then hear what the doctor just said, use that information to share these big decisions you have to make, right? And then after you make all these decisions, you have to be able to feel comfortable knowing that what you need to know so that you can implement those decisions, those treatment decisions, and move ahead with big things like chemotherapy, anti-HER2 therapy, immunotherapy, obviously surgery, radiation, um, endocrine therapy, those anti-estrogen therapies. So breastcancer.org has been creating expert medical information over 25 years, and we have really worked hard at building trust. Something that has to be earned, is precious, and can never be assumed. And I think that you can trust advocacy groups that like breastcancer.org, because we are a nonprofit, we are mission driven. We're not here to tell you what to do, we're not here to sell you anything. We help you understand your options, prepare for appointments, and navigate this overwhelming complex medical terminology that we were just talking about. We also encourage you, like Nancy said, to bring someone with you, another set of ears, someone that can really take notes, help you ask the difficult questions. It's not about, you don't bring someone with you just because you want you want they want they're that you want them to take over for you. No, 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 no. It's about empowerment and partnership, and it's part of the whole idea of what we call shared decision making. But when you do go on the web, let's say your pathology report got downloaded, or maybe you felt something and you can't get into the doctor's office as quickly as you need to, or maybe the first appointment isn't for a while. You just, your mind, just naturally just goes to the worst place. Um, and then everybody who finds out that you have breast cancer, like maybe you told your sister or your mother or someone at church or a synagogue or a mosque, or maybe at work, someone, whatever, wherever, however the information got out, either you shared it, and I know everyone on this call believes that your privacy is really important, and whenever you're diagnosed with breast cancer, it's your news to share, not someone else's right to share it unless you've given that person permission. Um, but when you go online for information, which is the big driver, what sends people online is they are really in a panic. They want to know, what does this pathology report mean? What does it mean when it says the HER2 new, the histochemistry of for HER2 was +2, and now we have to send it for fluorescence in situ hybridization, like all these big words. Like, what does it mean? Well, you go online and you start reading and you can freak out, because there are tons of myths out there. Like right away, you'll hear stuff like, oh, you have breast cancer, maybe you shouldn't have been using antiperspirant, or maybe you shouldn't have been wearing an underwire bra. All those are myths, and they have not been uh, uh, established as a contributing factor or any cause of breast cancer. But it certainly does make a lot of people feel guilty and feel badly about what they've done in the past. And it just makes them suffer great more than they need to. There's no evidence. It's generally a myth, but one that it spreads all over the internet. Again, one size doesn't fit all, and you really need to find out what's in your situation specifically. And in general, my experience is that when people try to share their story with you, it's usually a bad story. And sometimes people turn their personal stories into like gospel. It becomes their religion, and people will go online. And I know this through operatingbreastcancer.org. We have moderators 24/7 just to make sure that when you go in there for a personal support, it's a safe place, and we don't allow people to sort of like hit you over the head with like what they did and what you should do. uh, what worked for them may not work for you. And as I said before, your situation is totally unique and probably very different from the person who's trying to tell you what to do. So you want to make sure that you know what your situation is uniquely, so that you can make the best decisions possible, uh, so that you can move forward to get the best care with the least side effects. When I was diagnosed, as Dr. Axelrod shared, I was diagnosed 15 years ago, and I have to tell you that everyone wanted to know exactly what I did in my treatment. I mean, patients were calling the office, like basically shaking down the secretary, saying like, and the receptionist, what did Dr. Weiss do? What did Dr. Weiss do? Why? Because it's really hard to be diagnosed, and it's so much complicated information to go through. And they thought, well, here's Dr. Weiss, started, she's a breast cancer doctor, and she started this, platform breastcancer.org. And why should I try to learn everything myself? I'll just do what she did and I'll probably be okay. But just to remind people, like, I had to make my own best decisions based on my own unique situation, based on information that was available 15 years ago. And that's all, that stuff is irrelevant now and irrelevant to anyone else even then. Plus, of course, we're all entitled to our privacy. It's interesting when celebrities share information, often you'll hear them share the information after they went through treatment, after they've sort of become, they've settled out, their life is sort of back on track, they feel a bit more confident. They're less likely to share it immediately when the world has been turned upside down. And as we've been saying, breast cancer is not just one disease, it's got many subtypes, and that's why your treatment must be tailored. I know that Dr. Axelrod, and our other speakers tonight, and the team at NYU spend so much time reviewing each person's individual situation. What is the extent and nature of your problem, the disease? What other medical considerations and conditions do you have? What are your social circumstances, language, job constraints, financial limitations, educational um, limitations, and also like what experiences have you had like in your family that may affect what you're doing. And just know that misinformation, like these myths and mantras, etc., can delay care, can add to confusion, create fear, and can prevent you from asking the right questions. we it's so important not to do it alone. You can feel lost and alone for sure. During the whole pandemic, all of us saw way too many people doing it alone. It is a scary time of life, and that personal connection, the tapping into your community, makes a big, huge difference. I mean, information overload is real. When you're feeling scared, a lot of people pull away. When For many people who don't know the language, who are fearful of coming forward because of citizenship issues, who are fearful that they're from a culture where they feel like the cancer diagnosis is their fault, which it's not, but people feel that way. People who are worried about losing their job, they the fear of all those fears can push off a diagnosis, so that when people finally come forward, their diagnosis is more delayed. And just know that in the hospital, we are professionals at protecting your privacy. Um, but you can always say, this is very important to protect my privacy and not share this information. That should be respected. uh, when you're overwhelmed, confused, and and trying to figure out what to do in a short period of time, you need to protect your energy. Uh, don't do all those non-critical tasks. Like housework, for example. When I was diagnosed, what I did is I took all the vacuum cleaners out of the closet. I put them around the house. People thought that way I was using them. And then in the back of in the bathroom and the kitchen counter, I had cleaning products everywhere. People thought, "Oh my God, Weiss, she's like a clean freak." I wasn't doing any cleaning. I just put the cleaning products out. It was just for perception. You want to delegate the non-critical tasks. One thing I did, because I know a lot of people and I've been, in the field a long time before I even had a diagnosis myself, is I wrote a script. Basically, I knew that friends and family were going to talk to each other about me, and I knew that the people who run the office were going to hear patients were going to ask them what was going on with Dr. Weiss. So I wrote a script of the information I was ready to share and exactly how to handle it for each of the people on my team, which was very useful for my team members, just so that they felt that they were respecting my privacy and then being able to say something that was okay to share. It also saved me an enormous amount of time and energy myself not to have to deal with it. Because you need that energy to make all those big decisions in a short period of time. Like Nancy was saying, you want to tap into your community and bring someone with you to appointments. Two heads are better than one when it comes to listening. Also, you feel more empowered, more confident when you're with someone rather than being alone when maybe the doctor's coming in with a team of people. The ratio is like can be overwhelming. At least if someone's with you, you feel more empowered. It definitely helps to have someone else there to listen, understand, remember what the doctor's saying, and help you make those hard decisions. You could go over things with a person you bring with you, the questions you want to ask, putting the most important questions at the top in case there's not enough time to get to everything, and they can prompt you. But as long as they don't take over, you don't want someone coming with you who's nosy, who is going to jibber jabber after. That is going to respect your autonomy, your right to be in charge of yourself. Um, and just remember, what gets people through a breast cancer diagnosis and through the other side isn't just science and medicine. It's definitely a connection to community, personal support, clarity, and to a team of people who can oversee your overall care, your holistic care. Because I'm sure Dr. Uh, Axelrod and our other colleagues who are on tonight know that, and it happens every day. I don't think I've ever seen one patient who just had one issue, breast cancer. It's usually a lot of other stuff going on in their lives. They might be a caretaker, their partner may have Parkinson's, the patient may have heart disease, may have just lost her job with benefits, maybe never had a job or benefits. Maybe it was just came into the country, was visiting their daughter, and then and all of a sudden, fast forward, everything gets turned upside down. Now they're diagnosed and they're far away from their family, let's say in Jamaica or someplace like that, as an example. Um, so it's important to give people access to accurate medical information and personal support. That's the mission of breastcancer.org, because um, when you're empowered with expert medical information and personal support, you're going to make better decisions that can lead to earlier diagnoses, more effective treatments, better management of any side effects, and better outcomes. And as we've heard, access isn't just helpful, it can save your life. And cancer really doesn't, it really affects everybody. It touches every family, every community, everywhere. So the real question is, when the time comes, like when you want to, where do you turn for medical information? Let's just say, as Nancy Stewart said, you have, after you finish your treatment, you were given a survivorship care plan, which is a really great document that it explains who the people are in your team, the treatments you've just been through, and maybe you want to, you know, explore now online, like what does that mean, what is this medicine I'm about to start taking? Do these two medicines get along with medicines I already may be on and all that stuff? Well, I hope that if you're in that situation, that you can go to the next slide. that when you're in that situation, you can feel that that breastcancer.org is a safe place to go for the medical expertise and personal support you need through our medical content and through our online community where people connect with each other. We have discussion boards that are moderated 24/7. Someone's day is someone else's night. We also have meetups for all different kinds of groups, which can be really helpful. Again, just want to thank you, everyone who's participating in the conference this evening and then and in the future. Anyone who's seeking information through this program, I thank you for participating and thanking my great colleague, Dr. Axelrod, and our other speakers who are amazing for the opportunity to participate and make a difference working together.
Fantastic. Fantastic. Okay. You know, we have, so our third speaker, we have a fantastic library services. It's fab. I always use it, and I've always had, great success in asking questions and looking for information and getting a lot of assistance. Caitlin Plovnick is the lead for education and curriculum integration at the NYU Health Sciences Library. She's a graduate of Simmons University Graduate School of Library and Information Science and has previously worked as a librarian for Seattle University, Sonoma State University, and UC Irvine. Her research interests include instruction and assessment of evidence-based medicine and information literacy skills. Fantastic. And Caitlin, hit us.
I'm going to talk about navigating evidence-based research. As a medical librarian, that's something I do very frequently. As a person in my personal life, I'm generally more likely to start by looking at public-facing consumer health sites like we've just heard about. Medline Plus is another good one. If people, I saw there was a question in the chat, or patient education resources. But once I've looked at those and I encounter some health advice or health claims, particularly if they mention that it's evidence-based, then the next thing I want to know is, what is that evidence? What is the science behind this? And that's where going back to original research can be really helpful. And so I'm going to talk a little bit about how to find and interpret original research. So just a very quick recap overview of the publication process. When I'm talking about original research, I mean published research that has to go through a pretty rigorous process to get out there in the world where you can find it if all is done well, including like starting with a question that is worth answering, getting approval to conduct a study, conducting it using the correct methods, and then after it's submitted to journals, having it be evaluated by editors and then peer reviewed by experts in the same field. A lot of sort of checks on the study before it can even get out there in the world for publication. And once it's released, it's opening itself up to more people reviewing it, responding to it. So that's kind of the landscape we're in. Within those studies, there's what's called a hierarchy of evidence. It has to do with the strength of evidence, but it really has to do with the different methods involved. So studies may vary from a case report involving one person to large clinical trials involving a lot of people and different types of controls. At the top of this pyramid here are systematic reviews and meta-analyses, which usually pool the results from a lot of different studies and involve some appraisal and work that's done with that evidence. It doesn't mean they're better. It doesn't mean this is a better study type. It just means there's more evidence involved. So I want to be clear about that. Other things that might come up when you're looking at articles or people are talking about articles are things like impact factor. This also doesn't necessarily speak to credibility. It speaks to impact factor relates to journals. How often is that journal cited within other studies? Or how often is that a specific author studied and how much have they published? Or looking at an individual article, you could see how often has that article been cited. And all of this really tells you not necessarily how good it is, but how much it's being spoken about and how many people are involved in that conversation, which is a clue towards reputability, unless everyone's talking about it because it's very, very wrong. But more often than not, seeing these higher numbers means that this research is really out there having an impact, and a lot of people have engaged with it. So those are some things to be aware of. But let's talk about looking at a claim and investigating a claim. So I found on WebMD just a little bit about the anti-cancer potential of green tea. And in the description, it mentioned that the evidence is spotty, but it said studies have shown some promising results. But it didn't link to the studies. It didn't give me any information about what those studies were. So I might say, huh, interesting. I think I'm going to see if I can find studies myself and see if I can find what it's referencing there. So some places where you can search where you don't need a subscription to access them. I have some links here. PubMed Central, you can find full text information there. That's all research from NIH and the National Library of Medicine. Google Scholar is the Google search engine for scholarly literature. You might not be able to access full text always from Google Scholar, but it's a good place to search, find a lot of things, and you can see that information, like how many people have cited this article and who are they, so you can follow a conversation. Trip Medical Database is another one that has some freely available information. I like that one because it has a little bit of appraisal baked in, so you can look at it and see what other people have said about those studies. As a librarian, of course, I'm going to make a plug for libraries. I work at the NYU Health Sciences Library, but many institutions have libraries. Public libraries also provide access to research databases, so it's something to be aware of. I can click on this real quick. I'm not going to take you through a full search, but just to see, so you can see what it looks like, I went into PubMed Central, I looked up green tea and cancer, and I'm finding some articles that I could then click through, get more information. And we're going to take a look at this article in particular. ChatGPT has already come up several times in every presentation, so here it is again. You can use it for other things, and sometimes it will give you accurate information, but sometimes it won't. And it's not what it's designed for. It's not an information retrieval service. It's more predictive than that. So I'm citing a study here that showed that it provided answers of limited quality, and sometimes it just made stuff up, which it does. So it doesn't provide you with the context you might be needing to check the validity of evidence, or just know more about what's going on. So don't use it for those reasons. Or if you do, and it tells you something, please check that evidence. Maybe that would be another reason to go back into original research. So I found this systematic review on green tea for the prevention of cancer. If I'm looking at a study, now these are written at an expert level, and I am not a clinician, I'm not a biostatistician. It's not really written necessarily for me, but there are things I know to look for when I'm reading an article. So what kind of study type is it? And where does it fit in that hierarchy of evidence? I know that this is a systematic review. I'm familiar with the Cochrane database of systematic reviews. I know they're very, very rigorous, but I could look into information about them if I didn't know that and find out what their peer review process is and all of that stuff. I could look at the authors and what their expertise is, where they're affiliated. And I can look at how recent this was. How recently was it updated? Is there maybe more research out there that I should be paying attention to? I can also look at information of how many people have engaged with this. There's a lot there. This has not been retracted, but that's definitely something I want to pay attention to, is has a study been retracted after publication for some reason, in which case I'm not going to trust it as much. There's a website, Retraction Watch, which keeps a database of retracted articles. Or if you're looking at a reputable journal and you're looking at the actual journal site of where the article was published, hopefully they will provide a note to tell you that something has happened since publication. So once I'm looking through that article, other things I want to look at are the methods section. This is a systematic review, so they're going to tell me a little bit about what they did to find evidence, how they reviewed that evidence, what they did with it after they found it. But if I'm looking at an original research paper, I might look at, did the study involve human subjects or did it involve animal subjects? If it's something that worked on a mouse in a lab, how does that necessarily apply to me, a human? I might need more information on that. You could look at things like sample size. Was this tested on a very small amount of people or a very large amount of people? How generalizable is it? And articles should make an effort they should talk about the effort made to minimize bias. So you want to look for that in the methods and the introduction as well. And then there's a section of findings, which is, of course, the most exciting part, what actually happened. Look for the results, look at the discussion of the results and what they say you can do with them, and look to see if they list any limitations of the study. I feel like that's very important. If you're being transparent and you tell me about, there's always limitations of some sort. So what were you not able to do or find with this study? Then I'm much more likely to trust you and feel like you're not trying to manipulate me into buying something. So in this systematic review, they pulled all of these studies together, they did all their analysis and found that the results were inconsistent and more research is needed, which actually matches what the WebMD original claim said as well. So what can I do with this information? Maybe I'll drink green tea, or if I don't tolerate it well, or if it doesn't interact well with other things I'm taking, then like I don't have to worry about drinking green tea. Finally, the most important thing, and I am nearly finished, is context. So I'm talking about looking at an individual study and looking for what things to be aware of within that. But what's more important is the world of studies. So you don't need to get full into the science just to see, when you're looking at what's out there, how does a study compare to other studies? If there's one study that finds something and 200 studies that find the opposite, what's going on with that one study? And why is it different from the others? Maybe there's something they did differently, but that's what I want to know. Some people talked about how do you, in the questions, there were questions about avoiding overwhelm or what to do. And I think context to me is looking at how things relate to each other is important. And also looking at just how was it put together. So is there conversation around this study? Have people cited it? What did they say? And are there any published comments or notes? You'll often find that when you're looking online for research articles. And then within the article, did they disclose any conflicts of interest? I feel like that's similar to putting in the limitations. How much are they telling you about what they did? So that's all. That's all I got. We can move on to questions, but I hope that, I know that there's a lot of overwhelming information out there. There's so much research, there's more being produced all the time, but if you have a sense of where to look and what to look for, it can really help you put all the pieces of the puzzle together and have important knowledge. So thank you. Yeah, there's a lot there, and maybe I can share more information with the video as well, but open access doesn't necessarily mean anything about reputation. It just means, is the journal free for you to access or not? I think what you're talking about has a lot to do with journal reputation, and some of the things I mentioned, like impact factor, how often is it cited, how often is it read? That's really what people are looking at. A lot of that has to do with where researchers want to publish, because it looks good for them in their careers. But the way I would think about it too is it means more people are seeing it and more people are engaging with it. So if you're thinking about context in their overall conversation, you're getting more of that with articles that have been engaged with more. And for the journals that are considered very reputable, they have to protect their reputations by having these very strict criteria and having peer review processes in place, and not just putting up an article for anyone who pays to have it put up.
So with the Patient Education Committee, we're actually aiming toward a 6th grade reading level when we create new documents. And we actually are using AI now. Just after we create a new document, we do run it through AI and ask it to look at the reading level at a 6th grade reading level, and just to make sure, see if it has any, suggestions for us to make sure that we're writing at that level as well.
Good question. I mean, it's so interesting. The more rare the disease, the more likely people are going to go online. So, for example, if you have pancreatic cancer, which is an uncommon type of serious cancer, there's an organization, PanCan, that has a great reputation. That they have the capacity to hook you up with a navigator, a guide, basically to help you through your diagnosis, helping you find the best people where you live, let you know about clinical trials that you can participate in. Amazing. it would be really hard to do that for people with breast cancer because breast cancer is the most common cancer to affect women and affects men too, as you know. But because pancreatic cancer, thank goodness, is so uncommon, is why they can provide such a high level of service per person. But they do a great job, as an example.
I think it really depends on the patient, to be honest, because like I was talking about earlier, a lot of times when you first get that diagnosis, uh, you have that moment of panic, and often it's hard to process information at that time. Um, some people have had a moment to think about the diagnosis before they come in for their consultation and are ready to absorb information, and some aren't. So I think the important thing is just meeting the patient where they are. And like I said before, just providing them that resource for who they can reach out to for when things start to gel and they're actually ready to hear the information, who they can reach out to when they're ready to hear it.
Yeah, I totally agree with what you're saying, Nancy. I mean, there's so much information you need to learn in such a short period of time. It's overwhelming for anybody. When I was going through my own diagnosis 15 years ago, I know, and we've all taken care of people who are like, you know, brilliant people who've had the best education. They get stumped, they get stuck, they get overwhelmed too. So the most important thing in the beginning is to sort of help people understand that it's an urgency, but not an emergency. That that here's your team, here are their names, their phone numbers. Here's the navigator that's gonna help facilitate the appointments. Whatever you can do to sort of bring down the anxiety level, as Nancy's saying, people can then become more uh able to even hear what you're saying, remember it, understand it, be able to ask a question, hear and listen to what you just said as an answer, and start to make these decisions. And one of the things I'm amazed by, and I know everyone else who's on the call is also, that you can't rush through any of this. It takes time. It's a process. And at each step along the way, there's medical information and personal support that people need. And when you provide that, then they come up with new questions and new needs and new, like, okay, well, I thought I was finished everything. Now you want me to do this? How do I do that? What does that involve? My job, my benefits? Do I need to speak to a social worker? I mean, so it's a lot in a short period of time. And it's great that you have the privilege of working together as a fabulous team to provide these different aspects of care. And of course, there's always something that we can do better, which is why we continue to every day try to do a little bit better job of taking care of people. One thing I do that really I think is helpful is when I meet somebody, I always ask them, how can I be most helpful to you today? And then I stop and listen to the answer. And often I'll hear what the person, how they think, what's on their mind, what their burning question is. Because the last thing we want to do is start going down a runway of like with an answer that we think they might want to know, but when they're preoccupied with something else, like maybe they just had a bone scan, you didn't order it, someone else did, you didn't know they ordered it, and you're talking about blah 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 blah, and they're just all they can think about is like the bone scan, the bone scan, the bone scan. What did it do? I had back pain from raking yesterday or whatever, lifting something up. Is it cancer in my back? That's all they're thinking about. So if you start the meeting by saying, or if you're a patient listening and saying, here's how you can be most helpful to me at this time. This is what I really need to know. That is a great way to get the care that you need sooner than later.
Fantastic. I would encourage everyone to go on the newest vital sign and look up your health literacy by reading the ice cream label and then getting your family and friends, because I think it's important. I think we'll be able to do a better job of understanding what's recommended to us when we all become patients, right?